Come back to chest, pulmonary edema, bronchiectasis. Come to abdomen, necrotizing enterocolitis. Come to kidney, MPG and type 1. Come to the breast, this in mammography, in duct ectasia, you will see this. Nice. Okay, grades of clubbing. Acha, theek hai. Grades of clubbing, like in general, they have asked only one question regarding clubbing. That tell me the respiratory cause of clubbing, tell me the cardiac cause of clubbing. Now, clubbing, why does clubbing happen? Whenever you will have hypoxia in your body, hypoxia leads to end artery dilation. Hypoxia leads to end artery dilatation, and that end artery dilatation that's lead to clubbing. So, what are the hypoxic condition? In cardiac condition for clubbing, any hypoxic conditions, high cyanotic condition like tetralogy or fallow. So TOF patient clubbing is very common because hypoxic condition eventually will leads to end artery dilatation, and that these are the end arteries, the fingers, and that leads to clubbing. Okay, and what else? Respiratory cause of clubbing. Respiratory cause of clubbing: COPD, emphysema. These are the respiratory causes of clubbing, remember that. And there are multiple grades of clubbing. In grade 1 you will have the nail blood fluctuation, obliteration of the Lovey bond angle, you will have parrot beak appearance, and then you start having pain in your fingers and joints, that is pulmonary hypertrophy osteoarthropathy. They ask an exam, parrot beak appearance or a drumstick appearance is seen in which grade of clubbing? That is the one you need to know, that parrot beak appearance is seen in grade 3 of clubbing, that you should remember. Okay, this part is done. And yeah, this is the Shamrod sign. It's a clinical question basically. This is the Shamrod sign like this, and then normally if I touch fingers like this, a diamond should be visible inside like this, and the diamond should be visible like it should be some that's what diamond should be visible. If you can see this arrow, no, this one, so this is a diamond inside, and this is like gone. That's what clubbed. So this is what is his feet, if you can make out. So it's a congenital CTEV. Okay, it's a club foot, congenital club foot. Okay, he was not treated because he was not cosmetically corrected. So congenital talipes equinus virus. It's a congenital CTEV club foot. It is okay. Very good. Yeah, this is the case we have our hospital also, club foot patient. Okay, very good. This also same club foot, the left side. Very good. What is this? This is the umbilical clamp. Okay, two finger, we clamp it 2 finger away from the umbilical cord. Okay, what else? This is the diaper. This is a temperature sensor probe. This is the temperature sensor probe. This pipe has attached to the neonatal warmer. Okay, so that will be like, it will be keep checking the neonate temperature and the machine temperature, they'll synchronize together. This is the cannula, blue color cannula or purple color cannula. Yeah, cannula is very important. So remember, okay, 16 18. Okay, 16 number cannula is what, 18 number cannula is what? So remember, gray green, gray green. 16 number cannula is gray, 18 number cannula is green. 20 number cannula is pink, 20 is pink. 22 number cannula is blue, 24 number cannula is yellow, and 26 is the thinnest one, sabse patla, jo we use in newborns baby. So it's a purple color cannula, or some book says violet color cannula. So 26 is purple, 24 yellow, 22 blue, 20 pink, 16 18 gray green. Sabse mota, the thickest will be the orange. All are the even numbers, only except one, that is 17, which is white color cannula. This is very important. The exam question was this one. Blue color cannula is which number? 22 number is blue color cannula, and these all you know. So gray green, 16 18, 20 pink, 22 blue, 24 yellow, 26 purple, 14 thickest orange, and 17 is white, odd number. This this is the this is the size of the cannula. Told you, color told you. Flow rate also, in some question they had asked the flow rate, but if I die also, I'll never remember flow rates. So flow rates is boring. I'm not going to remember. If you want to remember, enjoy. Acha, so simple question. This 5-year-old boy has taken a coin inside. We have done that. So 5-year-old boy taken a coin inside. Right now at this patient, if the patient is asymptomatic, what do you want to do? If the patient is asymptomatic and it is just a coin, then what do you want to do? Nothing. You wait for 24 hours. You wait for 24 hours. If still it is at the same position, remove it. That's it. Adrenaline, yes, very nice. What is the dose of adrenaline in neonatal resuscitation? First of all, when will you use adrenaline? You will use adrenaline like normally. What happen if a newborn baby is having heart rate less than 60? You will do chest compression and bag and mask ventilation. You will do it for 60 seconds. And if still the heart rate is less than 60, then you will give adrenaline. So the indication of, I in my Bangalore class, I asked a student, when do you give adrenaline? He said, sir, heart rate less than 60, we give adrenaline. So that's a wrong answer. After 60 seconds of chest compression and bag and mask ventilation, if the heart rate is less than 60, then you will give adrenaline. And what is the dose of adrenaline? It is 0.2 ml per kg in 1 is to 10,000 dilution. Before it was zero point 0.1 to zero point 0.3 ml per kg, but now NRP 8th edition has told 0.2 ml per kg in 1 is to 10,000 dilution. As you can see, this ampule, this is ampule, okay, and the one something like this is a vial, that is a vial, and the something like this. So this is like a, remember it's an ampule, okay, and yeah, this adrenaline ampule, it comes in 1 is to 1000 dilution. It's written over here, 1 is to 1000 dilution. So you take 1 ml of adrenaline, take 9 ml of normal saline. So now this becomes automatically 10 times dilute. This is known as 1 is to 10,000 dilution. And of that, you will take 0.2 ml per kg. Actually, some books have asked in mg per kg also. So 0.2 ml per kg means 0.02 mg per kg. So in mg per kg, if I ask you the dose of adrenaline in neonatal resuscitation, it will be 0.02 mg per kg in 1 is to 10,000 dilution. This patient has hemoglobin of 9. This patient has HB9. So I told you less than 7 is severe anemia, 7 to 10 is moderate anemia, 10 to 11 is mild anemia. This is for pediatric population, 6 months to 5 years. So 7 to 10. So this patient is coming under moderate anemia, number one. And then I told you the which type of anemia you need to know the MCV and MCH. The normal MCV is 80 to 100. This patient MCV is 108 femtoliter. MCH normal is 30 plus minus 3 picogram. This patient has MCH 33, which is fair. So macrocytic anemia, very, very important. What do you want to make out? So I would like to ask whether the patient is a vegetarian or not, because I would like to rule out megaloblastic anemia. What else the patient will have, or the MCQ will have for megaloblastic anemia? Number one, the peripheral blood smear. Peripheral blood smear will show hypersegmented neutrophils. That word is important. Where do you see more than 5 lobed hypersegmented neutrophils? Megaloblastic anemia, peripheral blood smear, typical picture. Number one. Number two, it will be a chubby child. It will be a chubby child. Remember that. Chubby child, and one very, very important point is hyperpigmented knuckles. Hyperpigmented knuckles. These knuckles will be black, 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 black. Hyperpigmented knuckles. There is some connection of homocysteine methionine something which causes this black, black. So just remember hyperpigmented knuckles, chubby child, and that's what. So you'll think of megaloblastic anemia. And if I have a megaloblastic anemia, I can land up into which problem later? Infantile tremor syndrome. There is something known as infantile tremor syndrome, ITS, infantile tremor syndrome. Okay, that also patient can land up into infantile tremor syndrome. That's it. Thank you so much everyone. Please take care. Life is beautiful, and बस अच्छे अच्छे पढ़ना है, खुश रहना है. You must be happy, and don't say that I will be happy. Say I am happy. You are a happy soul. Tell yourself. You will not be happy once you achieve something. You will achieve undoubtedly always everything, but you will be happy while achieving, not happy after achieving. Not if I study, then only I'll be happy. I'll be happy and I'll be studying continuously. While studying, I'll be happy. Not after. Change after to while. I'll not be happy after I buy a house. I will be happy while planning to buy a house. That's life, you know. Life is a one-time show. Use it well. Life is a journey. Enjoy the show, okay? So please take care. Hello everyone. Welcome to Pediatrics by Dr. Anand. This is Cerebellum Revision Course Part 11. Before starting any segment, we always have a quote. And what is the quote for today? The quote for today is this one. So there are some people in your life which are very, very happy to see you happy. And there are some people vice versa. Okay, so life is beautiful, you know. Zindagi, I always say in Hindi that Zindagi Bhagwan ki ek bahut mehengi gift hai. Life is such a beautiful thing. It really doesn't matter what people think about us. It really doesn't matter what people say about us. What really matters, what you think about you, what you talk about you. So always be happy, always stay positive, do what your heart says. Don't do what others will think. Don't do what impress others. That is not gonna work. You're just wasting your time. Do what you feel is right, then everything will make sense by the end of the day.
The first question we have over here is this one. Very importantly, yes, we have this patient, and what are the findings shown below? So very important in this X-ray, we can appreciate what? We can appreciate the cupping, fraying, and splaying appearance. Just simple, quickly one-liner. We have the cupping, fraying, and splaying appearance. Where do you see cupping, fraying, and splaying appearance? You see in a case of classical rickets. So this is a case of classical rickets where we're gonna give vitamin D therapy. We always give vitamin D therapy. 60,000 international unit sachets there. We give nowadays 5 doses. Total 3 lakh international units of vitamin D will be given to this child in a case of rickets. If previously we were giving 6 lakh IU, now we are giving 3 lakh IU. Next question. This baby is standing, or what is the milestone? Like, what is the age? What is the age of this baby? If I ask you this question, simple question, simple answer. Can this baby stand and walk? Yes. So when can a baby independently stand? A baby can independently stands by 12 months, means 1 year. 12 to 13 months, he gonna walk with one hand held. He gonna walk with one hand held. When can a baby walk independently? The answer is 15 months. And when can a baby run? The baby can run by 18 months. So the age of this baby is 18 months. So this is important for exam question. Please remember that. A baby can stand by 1 year. Baby can run by 18 months. So 12 to 13 months he will walk with one hand held. 15 months independently walk, and 18 months he's gonna run. So this child is kind of running. So I think this baby definitely is 1.5 and 1.5 year plus. That's what. Next question. So this one. What is the name of this surgery which is done for this baby? Okay. This is a baby we have. What is the name of the surgery we have done for this baby? It was a case of bilateral cleft lip. So very beautiful this surgery. This is, what is the name of this surgery? This is chyloplasty. So I'll repeat again, exam question. This is chyloplasty for this, for the cleft lip repair. Basically, chyloplasty is done. Okay. Next, what is this one? I tell this patient to put her feet just like she's putting her feet like again this one. Now this is a flat foot, right? Yes or no? This is known as pes planus, and it's nothing but a case of flat foot. I'm just showing you as many images as possible because image based memory plays a very important role. I tell this girl to put up because she can't have admission in army, because you need to have a beautiful arch. Once they put your paper, they put your feet on a bloating paper and they check whether the arch is there or not. So this is a pes planus, nothing but a flat foot case. Remember that. Okay, next question. This 7-year-old child came with complaints of this. Can you appreciate this yellowishness, on the eyes, on the sclera? Classical case of jaundice. It's a classical case of, you can say, jaundice, and one of the more important causes for jaundice is viral hepatitis. Which is the most commonest cause? Which is the most commonest viral hepatitis? Viral hepatitis A is the most commonest cause. Most commonest viral hepatitis is hepatitis A. And which one is because of fecal-oral route? If you're having contaminated water and all that, fecal-oral, which hepatitis will come? A and E spreads by fecal-oral route, and vitamin A is the most commonest type of hepatitis. And very importantly, there are a lot of causes for hepatitis. Even a Wilson disease can cause hepatitis. So if you can think of pre-hepatic, hepatic, and post-hepatic. Definitely pre-hepatic, we can think of any hemolysis, hemolytic anemias. Could be a liver damage, of course. Hepatic cause could be liver disease, could be cirrhosis of liver. And post-hepatic could be some obstruction basically, or a tumor. So pre-hepatic, one cause we thought of hemolytic anemia. Hepatic means cirrhosis, and post-hepatic means any obstruction. So one cause. It's a viva question, you should know. Next question, very importantly, you should know. Yes, this is a typhoid conjugate vaccine. Typhoid conjugate vaccine. Now they ask simple question. A typhoid vaccine, if you want to give. Now most importantly, okay, I'm writing over here typhoid vaccine. What all questions you should know regarding the typhoid conjugate vaccine? If I ask you a question about dose of this vaccine, all the vaccines, the dose is 0.5 ml. Number one. Number two, route of this vaccine. Mostly vaccines are intramuscular route, except BCG, which is intradermal, and except this MMR, which is what you call MMR, and even chickenpox, you can say they are subcutaneous. MMR definitely subcutaneous, given on the right arm. BCG is given on the left arm, intradermal, and the rest all intramuscular. Okay, and intramuscular injection. And when do you give? According to the IAP, Indian Academy Pediatrics IAP schedule, you will give one dose at 9 to 12 months, and the second dose will be given, the booster dose will be given at 2 years. So first dose at 9 months and booster dose at 2 years. Remember that you give. And where, how do you store this vaccine? All the vaccines are stored under 2 to 8 degrees Celsius, except the oral polio vaccine, which is stored under minus 20 degrees Celsius. Bowing of legs. Comment and tell 6 causes. Quite a good question actually. So we all know that rickets is one cause where the patient has bowing of legs and widening of wrist. Most importantly, very importantly, maybe could be a fracture, that's why it's behaving like this. Maybe could be a case of osteogenesis imperfecta. Maybe it is a fracture which has not healed properly, a fracture which has not healed. So that these could be the causes: rickets, osteogenesis imperfecta, fracture which has not healed properly. And other diseases we have something known as bone dysplasia. Maybe he's suffering from bone dysplasia. Maybe it's a case of poisoning, lead poisoning or fluoride poisoning. Lead poisoning or fluoride poisoning also rarely down are the causes, but definitely rickets is the one with bowing of legs and widening of wrist. Very classical question, we have done that multiple times. The intestine basically has gone up. Once the intestine has gone up, the exam entrance question number 1, what is this? This is a CDH. What is CDH? Congenital diaphragmatic hernia. It's a case of congenital means by birth, diaphragmatic, diaphragm which separates the thorax from the abdomen. So congenital diaphragmatic hernia. The most commonest type of CDH, congenital diaphragmatic hernia, is Bock-Delac hernia. It's an exam question. Bock-Delac hernia is an exam question, and it's one of the, this is known as a posterolateral variety. Okay, it's an exam question. How will the patient present? Naturally, fall, my intestine has gone up, my lung has been collapsed, I'll have distress, tachycardia, tachypnea. In this case, number 1, bag and mask ventilation definitely is contraindicated. Star mark, it's an exam question. Bag and mask ventilation or positive pressure ventilation is contraindicated. A question was like, if a baby is having heart rate less than 100, what will you do? Normal newborn baby heart rate less than 100, of course you will do bag and mask ventilation. Because if a baby is having heart rate less than 60, then you will do chest compression and bag and mask ventilation. But only heart rate less than 100, you will do bag and mask ventilation. But if someone is suffering from congenital diaphragmatic hernia with the heart rate less than 100, then what will you do? Because in CDH's bag and mask ventilation is contraindicated. So you will intubate and ventilate the child. Just simple words, you will intubate and put the patient on ventilator. Ventilator will give the assisted breaths, how much ever is required, but you will not give. So intubate and ventilate. This patient, very importantly, you can appreciate now. If you look at very careful, this baby is having squint actually. This baby is having left squint. Iski aankhein ek taraf ki tedi halki si. This baby is having squint. And if you draw a straight line, a very classical point, let me appreciate with you. So this one. So number 1, this baby is having squint. And secondly, if you draw a straight line from the medial canthus to the lateral canthus like that, so this patient has low set ears. This patient has low set ears. Normally this 1/3 should be above like that. So low set ears the patient will have, number 1. Number 2, one more thing I told, the patient has squint. So squint with low set ear, this patient, there's a finding in this patient. Okay, one more finding if I show you. Yes, at the lower back of this patient, there is bunch of hair at the lower back. This patient has some bunch of hair at the lower back. So this is a classical case of spina bifida occulta. Occulta means hidden. This patient has a neural tube defect, but that is hidden. So spina bifida occulta is the best answer for this question. Very beautiful question. A bluish patch of this baby. What is this? I think this looks like a Mongolian spot. This looks like a Mongolian spot. Will it fade away? Yes, it will fade away. It's an exam question. True or false? And what is the most commonest location for Mongolian spot? The answer is lumbosacral region. This part is done. Yes, this is what, this is a nice thing. Have you heard of pigeon shaped chest and funnel shaped chest? If your AP diameter is more than the transverse diameter, this is known as pectus carinatum. This is known as pectus carinatum, C-A-R-I carinatum. So we have something known as pectus carinatum and something known as pectus excavatum. So pectus carinatum, the AP diameter will be more than the transverse, and opposite of that, AP diameter less than the transverse will be pectus excavatum. Okay, so this will be a pigeon and this will be a funnel. Pigeon shaped chest and funnel shaped chest is just a imaginary, like image based finding. This baby has a triad of high arch palate. This baby has high arch palate, number one. Number two, this baby has large ears. High arch palate with large ears plus developmental delay. So high arch palate plus large ears plus developmental delay. And remember MMM. This is a male patient with macrocephaly. Everything is large in this patient. Male patient with macrocephaly with mental retardation. Of course, mental retardation is now known as intellectual disability, just to have that mnemonic MMM. So I'm saying male patient with macrocephaly with mental retardation with what? With large ears, with large testes. Everything is large head, my macrocephaly, large testes, large ears. So what do you think? The best answer for this question, we are talking about fragile X syndrome. We are talking about fragile X syndrome. Okay. One thing which is not large in this patient is an exam question. N for no, N for nose. So nose is not large. Nose is not large, remember, in this patient. Okay. So these are the important points you should know. Fragile X syndrome. Yeah. So everything I told, male patient, mental retardation, long face, prominent forehead, large testes, large ears, but not large nose. Remember that. Which is the first and second most common cause of intellectual disability in pediatric population? The most commonest cause of intellectual disability is Down syndrome, and second most commonest is Fragile X syndrome. Please note, these are the non-preventable cause of mental retardation. These are the non-preventable. Someone is having Down syndrome, I'm sorry, he will have Down syndrome. I cannot do anything. We can't prevent it. Which is the most common preventable cause of intellectual disability? The answer is congenital hypothyroidism. Congenital hypothyroidism are the preventable causes of mental retardation. Please remember that. Okay. Next point. Then, very nice. So figure of 8 appearance. Where do you see figure of 8 appearance? So very importantly, in which heart condition you find the shape of the heart? This is a supracardiac TAPVC. It's a supracardiac TAPVC where you see a figure of 8 appearance of supracardiac TAPVC. It's one of the cyanotic congenital heart disease. And yeah, so what you call the X-ray finding, I told you, so figure of 8 appearance, Snowman sign and all that. So yeah, that's what you should know. Okay, done. Next one, trident hand. Nice one. Trident. Okay, trident as in like this is a try. Like if you could look at the camera, this is a try. Normally I like this. So this try. Where do you see trident hand? So trident hand you see in achondroplasia. A for achondroplasia, A for autosomal dominant inheritance. And what is the gene mutation? FGFR3 gene mutation, achondroplasia. Remember that. Okay. If the mother has taken thalidomide during pregnancy, the baby can land up into this problem known as phocomelia. Phacomelia, these are nothing but the limb defects. So if the exam question, if the mother has taken thalidomide during pregnancy, the baby can land up into phocomelia. Yeah, that you should know. This is the classical case of phocomelia where the patient is having this limb abnormalities. Next, yeah, this part is done. Stay positive because staying negative will not help. That's such a nice quote. Stay positive. Simple. Why should I stay positive? Because staying negative has no benefit. That's why, dude, stay positive. Yes, beautiful question. This child has what? Very importantly, when the intestinal contents are out and they are not covered in a sac, I think we are talking about gastrochisis. We're talking about gastrochisis. There's a classical case of gastrochisis. Remember that. Okay. Next question. The next point, yeah, the gastrochisis, we all know that. And what about this one? Again, classical gastrochisis, when everything is out. Yeah, when the intestinal contents are out, but they are covered in a shell, in a O. So O for omphalocele. The patient has omphalocele. Remember, in omphalocele, liver, spleen also can plus minus come out, but in gastrochisis, only intestine will come out. Remember that. It's again this omphalocele. Yeah. What she's showing? She's showing you a geographic tongue. Just because of multivitamins deficiency, they can show you a tongue known as geographic tongue. We have red beefy tongue, coated tongue. So geographic tongue, remember that. Beautiful geographic tongue because of multivitamin, folate, B12 deficiency. Yes, this is a case of what? All fingers of what? It's a case of pan-digital clubbing. Pan-digital clubbing. That also I have done in the previous slide also. What are the important causes? The respiratory cause for clubbing is COPD, emphysema, bronchiectasis, and cardiac causes tetralogy of Fallot. Beautiful quote, very beautiful, meaningful quote, which says this fellow has no hands, still he's using his brains. This fellow has hands, but he is using no brains. So stay positive, stay amazing, stay happy, stay fruitful, stay crazy, stay just on the edge, and life is so beautiful that way. So keep discovering yourself, it's just not studying is fine. I know you'll get a rank, इतना अच्छा पढ़ चल रहा है, किसका रैंक नहीं आ सकता. Such a beautiful way we are studying, किसी कुत्ते का रैंक भी आ जाएगा. Even Oscar also, if he studied like this, he'll get a rank. So getting a rank is not a big problem, but again, you have to stay positive and stay connected with your mind and have a very beautiful planned day and schedule. So very beautiful point which says, do your duty without thinking about its result. Your time will teach you everything, just don't forget to learn from it. That's quite a good quote. Do your duty without thinking about the result. Your time will teach you everything, just don't forget to learn from it. Very nice, very nice, very nice quote. Do not follow the majority, follow the right way. Yeah, that's very true. Not everyone is doing, I'm not supposed to do that. Everyone is born different, everyone is born amazing. My way of living is entirely different and yours is different. So do what you feel, because you are unique. Don't blame the distractions, improve your focus. Quite a point. That's quite a point. No, I can study, but they don't let me. I want to live, but they comment on me. I want to be happy. I have not done anything wrong. I don't know why people comment on me. I don't know why people are judgmental. So forget about they, if, that, and all that. Just focus. That's it. Yes. So where do you see butterfly rash? Any idea? So we all know that the butterfly rash or butterfly malar rash is seen in SLE, systemic lupus erythematosus, which is a small vessel vasculitis. The word autism day, when do you celebrate? Remember, 2nd April. 2nd April. 13th April, my mom's birthday. 2nd April, World Autism Day. Remember that. Okay. Autistic Pride Day is on 18th June. Autistic Pride Day is on 18th June, and World Autism Day is on 2nd April. Autistic Pride Day is 18th June, remember. Okay. Which number IV line cannula is this? We have done that. Blue color cannula is 22 number. Remember that. Next, we have Metrogel. I am a 10 kg baby. What is my dose of Metrogel? Metrogel, usually we give 10 mg per kg per dose TDS. Just remember, I'll not go too much detailing into it. Just this one, Metrogel, metronidazole for this amoebiasis, giardiasis, all this, acute gastroenteritis infections. So 10 mg per kg per dose, thrice a day we give. So it's a 10 kg baby. 10. I am a 10 kg baby. What's my dose? So 1 kg baby 10 mg, 10 kg baby 10 into 10 is 100. So 100 mg morning, afternoon, and evening. Ibuprofen. Ibuprofen, very importantly, has a great role in which condition? In the cardiac condition, if I talk about, to close the PDA, ibuprofen has a role. If I want to keep the PDA open, the drug of choice will be L-prostadil. But if you want to keep the PDA closed, the drug of choice will be ibuprofen. Indomethacin, ibuprofen, paracetamol, and ibuprofen we use in our NICU. And the dose of ibuprofen, very important, is 10 mg per kg per dose. Paracetamol dose is 15 mg per kg per dose, and ibuprofen dose is 10 mg per kg per dose. Remember that. Okay. So if you are a 12 kg baby, 12 into 10 is 120 mg. 120 mg. Remember. And each 5 ml contains 100 mg is written over here. So when 5 ml contains 100 mg, so then 120 mg contains how much ml? Like that, around 6 ml. So 6 ml will be the dose for the 12 kg baby. Yeah, this is fine. Yes. Yes. So what is this milestone? This is known as jargon milestone. That's baby is making this sound and talking to himself like that. This is a jargon milestone, comes by 15 months. Important milestone, jargon milestone, important milestone that you should know, jargon milestones. Yeah, jargon milestone. And one more thing also, I was thinking about one more milestone, I forgot. Yeah, what is casting milestone? Casting. What is casting? What is raising? What is casting? What is raising? Casting is deliberately throwing the objects. Whatever you give it to the baby will throw on your face. So 1-year-old child is showing casting, deliberately throwing the objects is known as casting, and raising is this. This is known as raising. So this is known as raising. 5 months baby can do raising, and casting is deliberately throwing the objects 1 year, and jargon milestones 15 months. Remember that. Okay. This baby. अब बनाओ, दोबारा बनाओ. जो बनाया था पहले वो दोबारा बनाओ. Yes. This baby had make a plus and he has made a circle. So we have done that. When can we draw a straight line? A straight line has two ends. So 2-year-old can make a straight line. When can we make a plus? A plus has 1, 2, 3, 4, 4 ends. So 4-year-old baby can make a plus. Between 2 and 4, we have 3. So 3-year-old baby can make a circle and is making a circle with a right hand. So handedness comes by 3 years. I'm a right-handed. My daughter is a left-handed. Comes by 3 years. Then it is difficult for a baby to make 4 points together like that. So 4.5 years old baby can make a square. 5-year-old can make a triangle and a 7-year-old can make a diamond. So these important milestones you should know. 5-year-old and 7-year-old is an exam question. FMG question, handedness comes by how many years? Circle, when can a baby make? All these are back-to-back MCQs. So 2-year straight line, 4-year plus, 3-year circle, handedness comes by 3 years, 4.5 rectangle, 5-year triangle, 7-year diamond. That you should know. मेरा नाम अनीश है, मैं LKG में हूँ. When can I be knows his full name, age and sex? The baby knows his full name, age and sex by 3 years. He can go to toilet alone by 4 years. Now, which milestone is this baby showing to you? If I'm giving something with one hand, see, I gave him an ORS packet, he hold it like this. Yeah, this one. So this is very important. There's something known as bidextrous approach and something known as unidextrous approach. Holding something with both the hands is known as bidextrous, comes by 4 months. Holding something with one hand comes by unidextrous, comes by 6 months. So this child was holding something with one hand, he took it like that. So unidextrous approach comes by 6 months. And whatever I gave him, he put in the mouth, known as mouthing. Now see this, I gave him this and he's putting in the mouth, known as mouthing. Mouthing comes by 5 months or 5 to 6 months, mouthing comes by. That you should know. This baby, now this baby is shaking hands. This is just like, this is not a milestone, but it's just chilling out, nothing else. ORS packet we have already done in the diarrhea chapter, detailing sodium potassium we have done, so I'll not repeat again. We have done that ORS. Very beautiful. See, this is a case of cleft palate, cleft lip actually, palate, so you have to check the palate. So this is a case of bilateral cleft lip, and the name of the surgery we have is chyloplasty. I told you, for the surgical management of cleft lip we use chyloplasty. Okay, yeah, this side also, both side cleft lip procedure done under Smile Train Foundation. So it's a case of chyloplasty. Very beautiful quote in Hindi which says, अगर नीयत अच्छी हो, अगर नीयत अच्छी हो तो नसीब कभी बुरा नहीं होता. नीयत अच्छी होनी चाहिए. If your intention is so beautiful, so amazing, so crazy, I don't think so. Very beautiful quote I was hearing recently. It's very hard to get distracted. It's very hard to get distracted when you know what are you looking for. It's very hard to get distracted when you know what are you looking for. I love swimming. It's very hard to get distracted that I don't have to go to swimming. I love gymming. So it's very hard for me to get distracted. Someone saying, oh, let's go party, let's not go to gym. I know I have to go to gym, so I have to go to gym. I like teaching, so it's very hard to get distracted. Someone says do something else job. No, I like teaching. Money is coming amazing because I like my passion. So passion gives huge money. Okay. Yes, this is a very nice question. What do you think? So this patient is showing you what I hold it his hand like that, but again he kept like hand. His right hand is internally rotated and kind of flexed automatically. So it's very importantly, what is this? Is known as Erb's palsy. So this is a case of Erb's palsy where the patient is having a unilateral Muru's reflex. So unilateral Muru reflex, you will think of Erb's palsy, and it's like a policeman's tip. So Erb's palsy, you should know. This is very in simple words. So this baby have this small capillary hemangiomas. These are known as stalk bite. These are known as stalk bite or nevus simplex. They are the conditions in a newborn which looks abnormal but is normal. Over the neck, over here, they are normal. They're self-resolving. Okay, yes. This patient, right hand, I told her to lift it, she's lifting well. But left hand, when I told her, she's only lifted till here. Again, see, right hand, if I tell her she's lifting well, but left hand, if I tell her to lift, she's kind of, there's a problem here. She's not holding full. The power, she's not holding full. Actually, she was having a burn and contracture over here. That's why her hand is like this. So just as she was having a contraction. See, this hand is straight, but this is slightly flexed off. So she was having a contraction. Just want to show you. Very nice picture. This arrow. What is this arrow? So this arrow is a vaccine vial monitor. Have you heard this name? You might have heard this name. Vaccine vial monitor. This is a vaccine vial monitor basically, where you have this outer circle and inner square. So this should be white and this should be blue. If inner is white and outer is blue, this vaccine is good to use. This vaccine is good to use. So yes, this vaccine is good to use. But outside also blue and inner also blue, this vaccine is not good to use. So this is known as vaccine vial monitor. And one more thing also, in this vaccine, if I'm the highlighter part, it's written is stored in minus 20 degrees Celsius. In this vaccine, it is written that stored this vaccine is in minus 20 degrees Celsius. So which vaccine are we talking about? We are talking about oral polio vaccine. All the vaccines are stored under 2 to 8 degrees Celsius except the OPV, which is stored under minus 20 degrees Celsius. Typhoid conjugate vaccine we have done. Yeah, I've told you. This patient, a 7-year-old boy, came with complaints of unilateral knee swelling. You can appreciate this baby. Unilateral knee swelling, one-sided knee swelling. How do you approach this case? Tell me quickly 4 or 5 differentials for this one-side swelling. So number one is swelling. Number one, you have to see whether it is monoarthritis, oligoarthritis, or polyarthritis. Monoarthritis means one joint, as this child has. So differential diagnosis could be a fracture, could be septic arthritis, or could be tubercular arthritis. Fracture, septic arthritis, and tubercular arthritis are the examples of monoarthritis. What is oligo? What is poly? P for poly, P for panch. Mad means 5 in English. So P for poly, P for panch. Panch या 5 से ज़्यादा joint का involvement, 5 or more than 5 joint involvement is polyarthritis, seen in acute rheumatic fever. But acute rheumatic fever polyarthritis will be migratory, fleeting type of arthritis with no residual deformity in the previous joint. Here also swelling, here also swelling. After 3 days over here, after 4 days over here, they'll be painful and no residual deformity in the previous swelling. Matlab means if 5 days my swelling was here, it shifted from the right to this joint, this became totally okay. There is no residual deformity, remember that. So yeah, and oligoarthritis means 4 or less than 4, and the examples is Hinong, Schonlin, Purpura. So like that you have to evaluate in this child. That's why I was checking this child's hands and fingers whether he has some other joint involvements or not. Okay, and then also you can think of, is it a large joint swelling or a small joint swelling? Large joint swelling, of course, you can think of platelet disorders, hemophilia, even acute rheumatic fever, a large joint. Small joint swelling, will you think of a rheumatoid arthritis, where you have the swan neck and buttonhole deformity, early morning stiffness of joints. So that's why I was checking the fingers also of this patient, whether do you have pain or swelling in the fingers. They said no, there's no pain and swelling in the finger. There's only pain and swelling in the one joint, that is the left knee joint. So we thought of evaluating it and all that. So it's an abnormal inspiratory sound. This is known as stridor. It's an abnormal inspiratory sound. It was a FMG question. Stridor is inspiratory or expiratory, or it is inspiratory usually, but can be biphasic also, but usually book says inspiratory. It's an abnormal inspiratory sound, and the most commonest cause of stridor is, yes, the most commonest cause of stridor is laryngomalacia, where you see omega shaped epiglottis, which we've already done that. Okay, done. This is just my niece friends.
Hi everyone, welcome to Dr. On Classes. My question is, what are the conditions in a newborn which looks abnormal but abnormal?
Thank you.
Thank you.
So what are the conditions in a newborn which looks abnormal but are normal? So there are so many MCQs on that. A 3 days old baby having vaginal bleeding, the mother got worried, she took the baby to the ICU. What is the management? No management. Because of the maternal estrogen levels, because of the maternal hormones, you can have such problems in the baby. So number one, which hormone is responsible is an MCQ. The answer is maternal estrogen. And then vaginal bleeding MCQ, gynecomastia, galactoria. Galactoria means milk discharge from a male breast nipple. What do you want to do? Nothing to be done. It's fine. It's normal. That's what. Okay. Yes, this is a trident hand. This is like a trident hand, which I saw, which is seen in achondroplasia. So like this. So this is trident. Like one is different, one is different, one is different. So trident hand, like this, seen in achondroplasia. If the mother has taken anti-malarials during pregnancy, what problem the baby can have? If the mother has taken anti-malarial, the baby can have deafness. If the mother has taken alcohol, we have done that alcohol, so fetal alcohol, alcohol, so fetal alcohol. Fetal alcohol syndrome, we have done that. The baby will have what? The baby will have smooth philtrum and thin upper lip. Somewhere if you heard a smooth philtrum and thin upper lip, you will think of what you call fetal alcohol syndrome. Smooth philtrum and thin upper lip. Okay. So if the mother has taken anti-malarials, the baby can have deafness. If the mother has taken alcohol, the baby can have fetal alcohol syndrome. If the mother has taken carbamazepine, the baby can have spina bifida. C for cervical, C for carbamazepine, C for spina bifida. Okay. If the mother has taken carbimazole, the baby can have some, remember only one thing, that is C for carbimazole, C for choanal atresia. This is like a one-liner which I'm talking. If the mother has taken dash, the baby can have dash, like that. Okay, so quickly we'll finish it off. And what do you call, these slides are very important, and just today tonight just call any one of your friend and just teach him this, that tell me now bro, if the mother has taken anti-malarials, the baby can have deafness. If the mother has taken alcohol, fetal alcohol syndrome. Carbamazepine, spina bifida. Carbimazole, C for carbimazole, C for choanal atresia. If the mother has taken cocaine, the baby can have small head known as microcephaly. So cocaine, if the mother is taking, the baby can have microcephaly. Microcephaly means head circumference less than -3 standard deviation. If the mother has taken danazol, the baby can have virilization. If the mother has taken danazol, the baby can have virilization, means female characters in male and male characters in female. If the mother has taken lithium, lithium we have done box shape heart, Epstein anomaly. If the mother has taken lithium, the baby can land up into Epstein anomaly. If the mother has taken misoprostol, M for misoprostol, M for Mobius syndrome. If the mother has taken misoprostol during pregnancy, the baby can land up into Mobius syndrome, which has cranial neuropathies. If the mother has taken phenytoin, so phenytoin and hydantoin. Phenytoin, so patient can have fetal hydantoin syndrome. If the mother has taken phenytoin, the baby can have fetal hydantoin syndrome. Quinine, if the mother has taken chloroquines. So if the mother has taken queen during pregnancy, abortion. Quinines they have taken, the baby can have abortions. Statins can cause vectoral anomaly. Vectoral anomaly is an exam question. If the mother has taken statins, the baby can have vectoral anomaly. Vectoral, they have asked in exam, what is C and what is R stands for. So vectoral anomaly are the group of defects the baby can have. V for vertebral defect, the baby can have. A for anorectal defect, baby can have. C for cardiac. T for tracheo. E for esophageal defect, the baby can have. R for renal. And L for limb abnormalities. So these defects the baby can have if the mother has taken statins during pregnancy, and C and R are the exam questions already. Okay, if the mother has taken tetracycline, T for tetracycline, T for teeth pigmentation. The baby can have teeth pigmentation. Remember that if the mother has taken tetracycline, the baby can have teeth pigmentation. If the mother has taken vitamin D, so this is nice. So vitamin D, two questions, one answer. Which is the most common congenital heart in Williams syndrome? The answer is supravalvular aortic stenosis. And Williams patient only will have hypercalcemia, because Dye-George patient will have Dye-George syndrome patient will have hypocalcemia, and Williams syndrome will have hypercalcemia. Number one. Number two, vitamin D also, if the mother has taken too much, the baby can land up into supravalvular aortic stenosis. Warfarin is an anticoagulant which will cause bleeding. So if the too much anticoagulant if you have taken, the baby will have bleeding. If the mother has taken erythromycin during pregnancy, the baby can land up into congenital hypertrophic pyloric stenosis. This one, right? This one, we have done that. This part basically congenital hypertrophic pyloric stenosis, and the name of the surgery for this one is Ramstead pyloromyotomy. The name of the surgery for CHPS is Ramstead pyloromyotomy. Remember that. Pyloric stenosis. Done. Again, stay positive. Staying negative will never help. A very beautiful quote which says, एक दिन शिकायत आपको वक्त से नहीं अपने आप से होगी. एक दिन शिकायत आपको वक्त से नहीं अपने आप से होगी कि खूबसूरत जिंदगी आपके सामने थी लेकिन आप उसको देख नहीं पाए. Once upon a time, a time will come in your life one day where you will have problem not with the word but with you. Not with the word but with you. Why? Because you had a beautiful life and you could not see it. You were busy in commenting people, you were busy in gossips, you were busy in negativity, you were busy in other problems which were not at all required. So stay positive, stay chilling out. Yes. So is this sitting with support or sitting without support? You might be thinking sitting with, but if I'm doing like this is known as sitting without support. So sitting with support comes by 6 months and sitting without support comes by 8 months. This patient, I'm putting knee and hip and knee flex to 90 degree. Again, it's a very quite interesting case. This patient right now, I am having this patient is having, yeah. So I'm putting this patient hip and knee. So this is the hip joint and this is the knee. Hip and knee flex to 90 degree. So I'm hip and knee flex to 90 degree. Now I will hyperextend the knee joint. If you look at the video very carefully, this patient now, what will I do? I will hyperextend. So this one and yeah. So one second. Yes. So now I hyperextended the knee joint. Once you hyperextend the knee joint, look at the patient's face. She will wince with pain. So the patient wins with the pain. What do you call this? It's a classical Kernick sign positive. So it's a signs of meningitis. We have Kernick sign, Brudzinski sign, and neck rigidity. This patient is Kernick's positive, means this patient has meningeal signs positive. I would like to we got a CSF pictures of this patient done, and it came out to be tubercular meningitis, where you have a sugar cum high protein and lymphocytic predominant. You will have in the CSF, you will have low sugar, you will have high protein, and you will have lymphocytic predominant. Then you will think of tubercular meningitis. Sugarless, high protein, and what we call neutrophil predominant, you will think of bacterial meningitis, but lymphocytic predominant will be of what we call the tubercular meningitis, TBM. So it was a case of TBM. So we gave 2 to 3 weeks of antibiotics. And 60 to 80 is the normal CSF sugar and protein, 60 to 80. So this is another MCQ which you have covered. They'll tell you one patient had come, he was having meningitis, lumbar puncture was done, CSF was taken, and the report was this. They'll give you C sugar of 40 or 35. They'll give you a protein of kind of 115 or 175, and will tell you they'll have 90%, 80% lymphocytes. So it's a case of TBM. Strawberry West. Where do you see strawberry tongue? Strawberry tongue, we all know that you will see in Kawasaki disease. So strawberry tongue you see in Kawasaki. Strawberry vagina you see in trichomoniasis. So strawberry tongue you will see in two conditions, one in Kawasaki and one in scarlet fever. So strawberry tongue you will see in Kawasaki and scarlet fever. Strawberry vagina you see in trichomoniasis. Strawberry gingiva. Gingiva are small, okay. So small vessel vasculitis, that is Wagner's granulomatosis. In a case of Wagner's granulomatosis, you will see strawberry vagina. So strawberry vagina you will see in Wagner's granulomatosis, strawberry vagina, trichomoniasis, strawberry gingiva, Wagner's granulomatosis, strawberry tongue, Kawasaki and scarlet. So strawberries are important. Strawberry scrotum, where do you see? Multiple sebaceous cysts. You see strawberry scrotum. Strawberry gallbladder, you will see in cholesterolosis, strawberry gallbladder. Strawberry skull, you will see in the ultrasound in the Edwards syndrome, trisomy 18, where you see rocker bottom feet. Strawberry tongue, Kawasaki and scarlet fever. Strawberry vagina, trichomoniasis. Strawberry tongue, strawberry gingiva, Wagner's granulomatosis. Again, I'm telling you that this is what you called, you have to call a friend and teach him this. The best way of how you remember such things, call and teach. Meet and teach. That's it. Okay. And let me know, do you remember such things? Are you liking the class? If yes, then let me know on WhatsApp. My number is 9999897081. What are the side effects of these drugs? Gray baby syndrome. Gray baby syndrome is a side effect of chloramphenicol. If you give chloramphenicol drug too much, the patient will have a gray baby syndrome. Bronze baby syndrome is a side effect of phototherapy. Too much of phototherapy can have a bronze baby syndrome. Blue man syndrome or blue baby syndrome is because of amiodarone. And red man syndrome is because of vancomycin. If you give vancomycin drug too fast or too much, you will have a red man syndrome. Okay. Then blue diaper. Blue baby was amiodarone. Blue diaper, it is seen in indicanuria. There is a condition known as indicanuria, where you have this Drummond syndrome, where the patient will have a bluish urine stained diaper. So indicanuria or Drummond's syndrome, remember that. Thompson liver and Thompson score. Thompson score you do in HIE. You know, the baby who have not cried immediately after birth have gone into hypoxic ischemic encephalopathy. We use 3 staging for that, HIE. One staging we can use is Sarnet and Sarnet, which is very big. One staging we use Levene staging, and one staging we use is what we call the Thompson score is used for HIE staging. Okay, Sarnet and Starnet has 3 stages: stage 1, stage 2, stage 3. Seizures are started to see in stage 2 HIE. Stage 1 HIE, you will have a exaggerated muru. Stage 3 HIE, you will have a absent muru. Stage 1 HIE, you will have mydriasis. Stage 2, you will have meiosis. and stage 3 will have unequal pupil. Thomson liver, where do you see? Thomson liver is seen in scarlet fever. So scarlet fever, remember, sandpaper-like rash, strawberry tongue, Thomson's liver, remember that, okay? Yes, once I inflate my BP cuff, my hand fingers has a carpopedal spasm. So why my this is having a carpopedal spasm? Because I'm having tetany. Now this is beautiful. See this patient also. We are inflating this patient's BP cuff and see. So classical, so classical, so classical. For this, I would like to thank Nitin, one of my junior, and he's amazing soul, huge, talented Dr. Nitin. Thank you so much. So classical carpopedal spasm. This too is naturally having carpopedal spasm. Okay, so it's a Trousier sign seen in latent tetany. See, that's it. That you should know. And what was that? What was this sign? Tapping of the angle of the mandible, facial twitching. This is Chowstek's sign. So Chowstek, this was Chowstek's sign. Remember that. So Trousier sign over Chowstek's sign. This see this also. If I tap here, she will have a Chowstek sign. Twitching of the facial muscles in response to tapping over the facial nerve. Tap the facial nerve, facial. Tap the facial nerve, twitching of the facial muscles. In this patient, most importantly, what I'm doing, I'm gonna occlude both of your arteries. I will occlude your radial artery and I'll occlude your ulnar artery. So see, I occluded. Now what will I do? I will open one artery. One hand I will open. I'll open one artery and I'll see the change in the color of your palm. See now, I will once I open this, see the change in the color of the palm means the blood is flowing well. Same procedure again. Now I will open your, in the beginning of both arteries, radial and ulnar arteries, I will occlude, but this time which artery I will open? This one, ulnar artery I will open. And what will I check? Same change in the color of the palm. See, I opened, see the change in the color of the palm, means this is known as very, very important Allen's test. It is done to make sure that the collateral circulation is present. Both artery, radial artery, all the circulation is pretty well. In the dialysis patient, before putting a arteriovenous fistula, AV fistula, we always have this collateral circulation. Next, we have everything will make sense. The struggle, the pain, the hard work. Everything will make sense. The pain, the struggle, the hard work. You keep working hard. That's it. Very importantly, this patient is a case of, remember that, Treacher-Collins syndrome. Okay, Treacher-Collins syndrome. What are the important points of Treacher-Collins syndrome? Remember this one, Gandhi ji ke teen mandar. Gandhi ji's three monkey. Gandhi ji said, don't see the bad stuff. But they saw the bad stuff, so they got coloboma of the eyes. Coloboma of the eyes. Gandhiji said, don't speak the bad stuff, but they spoke. They got microgonathia. Two syndrome associated with microgonathia. One was this Treacher-Collins syndrome, which we are studying, and one is Pierre-Robin syndrome. And Gandhiji said, don't hear the bad stuff. They saw, they heard some bad things. They got deafness. So this is the triad of coloboma, deafness, and microgonathia of Treacher-Collins syndrome. Treacher-Collins syndrome. Remember that. T for Treacher-Collins, T for TCOF1 gene mutation, and they are very, these students don't listen. So they are dominating students, autosomal dominant inheritance. That you should know. This is a coloboma. This is coloboma. See, this is a coloboma, a hole in one of the structure of the eye. This is a real patient of Treacher-Collins syndrome. You can appreciate the deafness, you can appreciate eyes coloboma, and you can appreciate the what you call microgonathia. And they will have an anti-mongoloid slant. Look at the eyes, they are downside like this, known as anti-mongoloid. If the eyes are upside, that is Down syndrome, known as mongoloid slant. This is anti-mongoloid slant. Beautiful. The patient has kind of a tall fingers or long fingers. So long fingers, what do you think of? You think of arachnodactyly, long fingers. Where do you see arachnodactyly? Marfan syndrome. You all know that. Marfan syndrome, the mnemonic itself is, see, long fingers. The patient will have long fingers. So Marfan itself is the mnemonic, which is the most common congenital heart in Marfan. M for Marfan, M for mitral valve prolapse. Which is the most common cause of death in Marfan syndrome? The most common cause of death in Marfan syndrome is aortic dissection. M for Marfan, A for arachnodactyly, long fingers, autosomal dominant it is. R for retinal detachment, F for fibrillin deficiency. This is also an exam question. Facebook, and I'm not on Facebook. FBN1 gene mutation you see in this one, Marfan syndrome. A for aortic dissection and A for arm span is more than my height. This is also a nice question. N for negative urinary nitroprusside test. The patient N for can have pneumothorax, and S for superior temporal subluxation of the lens. eyes they have lens problem. There's a subluxation of the superior lateral superior temporal subluxation of lens. This whole thing is same in a what you called homocystinuria patient also. Homocystinuria patient also will have a Marfanoid features or features of Marfan syndrome. The only remember thing is him. Homocystinuria will have an infero-medial subluxation of lens. The lens subluxation will be infero-medial in homocystinuria, whereas superior temporal subluxation is there in the Marfan syndrome. Actually, two things are seen very commonly: wrist sign and one more thing was sign was there. The wrist sign and thumb sign. Okay, this is thumb sign, wrist sign. Basically, thumb is what I'll tell to make a feast, and my thumb will be outside of my this one. So this is the thumb sign, and this is the finger wrist sign. I'll just little finger and what you call thumb. So they will intercross each other if I do like this. So known as wrist sign and the thumb sign. That's it. So wrist sign is also known as Walker Murdoch wrist sign. Just wrist sign and thumb sign. Remember that. And then this I have told you. Which of the following is not associated with developmental delay? Marfan syndrome also they chill out and come. Marfan syndrome also they don't have developmental delay. Duchenne muscular dystrophy baby will have an intellect problem. SMA will have. Tay-Sachs disease, which is a neurodegenerative disorder, they will expire by 3 to 4 years. And Prader-Willi also will have a developmental problem. Marfan, they're chilling out. Okay. घमंड है तो किस बात का, यहाँ हम सब किराएदार हैं. Very beautiful point which says arrogance. Why you have so much arrogance and ego? It's a very beautiful quote which says we need everything permanent. We need everything permanent in a temporary life. So it's a life is temporary and you need everything permanent. Why don't you just enjoy? Where do you see string sign? So CHPS, we have done that. String sign, multiple signs are there. So string sign you see in congenital hypertrophic pyloric stenosis. Double tract sign also you'll see in CHPS. Mother would have taken which drug? This one, what you call erythromycin. Christmas disease, Christmas tree cataract, Christmas tree rash, Christmas tree adapter, Christmas tree sign, Christmas tree bladder, and Christmas tree appearance of polyp. Again, first listen and call a friend and teach. Christmas disease, we all know that is pityriasis. Pityriasis rosea will have a Christmas tree rash. Pityriasis rosea will have a Christmas tree rash. And hemophilia B, because factor 9 deficiency is a Christmas disease. Christmas disease, hemophilia B, Christmas tree rash, pityriasis rosea. Christmas tree adapter is like a adapter for the oxygen tank. This is known as Christmas tree, like a Christmas tree adapter for oxygen tank. Christmas tree bladder is seen in neurogenic bladder. Neurogenic bladder. Let's revise again. It's very easy. Christmas tree rash, pityriasis rosea. Christmas disease, hemophilia B. Christmas tree adapter will be for the oxygen tank, and Christmas tree, what you called bladder, will be bladder. So neurogenic bladder. Christmas tree sign will be in the paraspinal CSF leak in radionuclide cysternography. In this radionuclide cysternography, there is a paraspinal CSF leak, and that is known as Christmas tree sign. Christmas tree cataract, you will see in myotonic dystrophy. Photographic memory, in myotonic dystrophy, you will have a Christmas tree cataract. And last Christmas tree appearance of polyp will be in Peutz-Jeghers syndrome. So this Christmas tree appearance of the polyp, you will see in Peutz-Jeghers syndrome. Quickly, let's revise again. Christmas tree rash, pityriasis rosea, Christmas disease, hemophilia, Christmas tree bladder, or Christmas tree adapter for the oxygen tank, Christmas tree bladder, neurogenic bladder, Christmas tree sign in the paraspinal CSF leak in radionuclide cysternography, Christmas tree cataract, myotonic dystrophy, and Christmas tree appearance of polyp will be P for polyp, P for Peutz-Jeghers syndrome. P for polyp, P for Peutz-Jeghers syndrome. When this is the Ames question, when two cranium are connected is craniopagus. When two head are connected, craniopagus. Two thorax are connected, thoracopagus. Two cranium are connected, craniopagus. Remember that. Okay. Lot of pagus are there. You know, thoracopagus, ischiopagus, parapagus, craniopagus, pyopagus. So craniopagus you should know. Be a warrior, not a warrior. Be a warrior. I will fight this, not a warrior. Oh my God, how it will happen. ठीक है. Next, very importantly, juvenile myoclonic epilepsy. Juvenile myoclonic epilepsy, the patient will have a twitching of fingers and dropping of objects. How the question will come regarding juvenile myoclonic epilepsy? Twitching of fingers and dropping of objects. Twitching of fingers and dropping of objects, this is how the patient will come. Is very clumsy, throwing everything and all that. So Gabra1 gene mutation, exam question. Twitching of fingers and dropping of objects, exam question. And drug of choice is sodium valproate. Drug of choice is sodium valproate, that also is exam question. Whereas sodium valproate is drug of choice, absence seizures also the drug of choice is sodium valproate. So isolated jerk, switching of fingers, dropping of objects, Gabra1 and ABCC2 gene mutation is in Dubin-Johnson syndrome. Yes, and this juvenile myoclonic epilepsy has a good prognosis. Drug of choice is sodium valproate. If I'm a girl and menstruating, then what will you give me? I am a JMA case, but I'm a girl. Will you give me sodium valproate? No. That time you'll give me topiramate, because as I'm menstruating and sodium valproate is teratogenic. It's a US Assembly question. A girl of JME was on sodium valproate, but she was menstruating. So and she got pregnant later. So it was connecting there. So remember, if I'm menstruating, don't give me sodium valproate, because sodium valproate is a teratogenic drug. Where do you see Wimberger sign? White line of Frankel and Pelkin's fracture. Beautiful answer. Scurvy. You will see Wimberger sign. Remember that. This is Keshan disease. This is a person of Keshan disease. Keshan disease because deficiency of selenium. Deficiency of selenium will have a problem known as Keshan disease. Exam entrance question number 1. What is the most common congenital heart disease in Keshan disease? The answer is dilated cardiomyopathy. So dilated cardiomyopathy, DCMP, remember that. Okay. Done. And the patient will have a garlicky odor, remember that. Okay. Yellow nail syndrome, the patient will have a number 1 respiratory problem known as bronchiectasis, number 1. Number 2, the patient will have a discolored nails. So that's a yellow nail, so discolored nails. So that's what. So respiratory problem, lymphedema, and discolored nails. So this is patient is having a lymphedema. There's a pitting edema. There's a yellow nail. So yellow nails, number 1. Then we have this lymphedema, and then we have this respiratory problem, YLR, yellow nails, lymphedema. So yellow for yellow nails, L for lymphedema, and we have this respiratory RS manifestation. Remember that. Okay. Okay, if I show you this picture, number 1, the patient is having, okay, I have shown you a penis, means the patient is having azoospermia. Okay, I have shown you a chest x-ray where the patient has bronchiectasis. Okay, so what is the triad of bronchiectasis and azoospermia and sinus? I'm showing you a healthy sinus and chronic sinusitis. So what is the triad of chronic sinusitis, bronchiectasis, and azoospermia? I think you know the answer. The answer is Young syndrome. So Young syndrome will have azoospermia, bronchiectasis, and chronic sinusitis. And chronic sinusitis, bronchiectasis, and the situs inversus, then the answer is Carter-Jenner syndrome. We have done that previously. Alport syndrome is also known as hereditary nephritis. Alport syndrome is a kidney problem known as hereditary nephritis. So how will I come? Like, what all question will come for Alport syndrome? You should know the triad. This is a triad. I have shown you an ear picture. The patient will have deafness. I have shown you a kidney picture. The patient will have hematuria. And I have shown you an eye picture. This is known as lenticonus. The lens has become cone shaped. So lenticonus. So deafness with sensorineural hearing loss with anterior lenticonus with hematuria is a triad of Alport syndrome. Cone shaped deformation of the anterior or posterior lens surface is known as anterior lenticonus. Alport syndrome is also known as hereditary nephritis. This is also very irritating point that 85% are X-linked recessive, 10% are AR, 5% are AD. It's a genetic disorder of the glomerular basement membrane. Triad, this was the exam question. Triad was the exam question. Okay, and yeah, this is fine. Yes, this is very nice. Laxity of the abdominal muscles. While looking at the picture, you tell the diagnosis. Laxity of the abdominal muscles. What are we talking about? We're talking about the prune belly syndrome. In prune belly syndrome, there's a laxity of the abdominal muscles. Prune belly syndrome. So prune belly syndrome will have a laxity of the abdominal muscles. Very nice. This is one liner. This is prune belly or Eagle-Barrett syndrome, the triad syndrome. It's also known as a triad syndrome. I told you laxity or the deficient, like very loose abdominal muscles, and also the patient will have undescended testes. So this much only in Nelson they have given. And remember this, prune belly has U. Okay, so U and U. So undescended testes and urinary tract abnormalities. Remember that. You seen what you called prune belly syndrome. And belly means abdomen. So belly, the belly is very laxative, very loose. So that's what belly is loose. Belly is loose. And finish. And what else? Yeah, that's it. Here's a good question. Which is the most common cause of congenital hypothyroidism? Why my thyroid gland is not working? Number one, your thyroid gland is not working because your thyroid gland has not formed only. The most commonest cause of congenital hypothyroidism is thyroid dysgenesis. Okay, if my thyroid gland is formed, but then what is the most commonest cause of congenital hypothyroidism? Dysharmonogenesis. Your thyroid gland is there, but its hormones are not working. So the most commonest cause of congenital hypothyroidism is thyroid dysgenesis. Second most common is thyroid dysharmonogenesis, and the third is the acquired cause, which is the most common acquired cause of congenital hypothyroidism. That is autoimmune thyroiditis, or Hashimoto thyroiditis. Very simple, easy question. 3 questions over. So thyroid dysgenesis, dysharmonogenesis, and the acquired causes autoimmune thyroiditis. That's what. And thyroid dysgenesis, no, naturally dysgenesis bana hi nahi hai thyroid. It's not there only. So T3, T4 will be low, and automatically the TSH will be high. Okay. So thyroid, that is why that's what you should know. And thyroid has not formed only. So goiter also is absent in this case. Thyroid dysharmonogenesis, there's a compensatory feedback to the brain will go, and that will cause goiter. Remember, thyroid dysgenesis, goiter absent, dysharmonogenesis, hormones are fluctuating, so background may feedback mechanism, they will, it can cause goiter. That you should know. Then this is fun. Pendred syndrome also one is there. Pendred, this is a triad, you should know. Pendred, nothing, what a picture I've shown you. I've shown you ear picture, so the patient will have deafness or sensorineural hearing loss. Every syndrome will have deafness. Next, very importantly, I'm showing you thyroid gland. I'm showing you. So there's a mutation in the thyroid and cochlea. One is in the thyroid mutation, one is a cochlea mutation. Mutation in the chloride iodide transport in the thyroid as well as cochlea. So that's what. So cochlea, I will have SNHL, sensorineural hearing loss, and thyroid I will have hypothyroidism, which will cause goiter. So goiter with hypothyroidism with SNHL is the triad for Pendred syndrome. This was a NEET PG question. Just this much only you should know. Okay, and it is an autosomal recessive on the chromosome number 7. That's this part is done. What else? Yeah, and cystic fibrosis also you will have chromosome 7. Yes, I know. Cystic fibrosis also chromosome 7. Pendred also chromosome 7 mutation. Chromosome 5, 5p deletion. 5p deletion was there in Cry-Du-Chart syndrome. Remember, 5p deletion was there in Cry-Du-Chart syndrome. Yeah, 5p. Yes, very nice question. This is a coffee bean. Coffee beans, no? Coffee bean. So where do you see coffee bean? This is the coffee bean. So beautiful. This is the coffee bean, and this is the other coffee bean. So coffee bean sign you see in sigmoid volvulus. Coffee bean sign you will see in sigmoid volvulus. Remember that. Coffee bean sign. That's it. Sigmoid, simple line answer. Last question. This patient has webbed neck with decreased cervical range of motion. This patient has webbed neck. I know it's a female patient. Now you'll think of Turner. No, this patient had this decreased cervical range of motion. Decreased cervical range of motion. Okay, and her C1 and C2 are fused. Atlas axis vertebra are fused. So what are we talking about? We're talking about Klippel-Feil syndrome. There's something known as Klippel-Feil syndrome where the patient have low posterior hairline. See, normally my hairs are this till here, but this patient has low posterior, very down the hair are there. Short neck, decreased cervical range of motion, fusion of the vertebra, Klippel-Feil syndrome. Remember that. That's it. And beautiful point it says बेहिसाब हंसते ना पालिए जो मिला है उसे संभालिए. Don't dream big. Yeah, you can dream big. It's good to dream big, but whatever you have also appreciate that. Okay, that's it. And believe you can, and you're halfway there. That finishes the what you call revision for the CRC cerebellum revision course. And listen, one more important thing. After this, now I'll be sharing a PDF file with you. Okay, after this I'll share a PDF file with you. I want you guys to just go through it and just read them. Whatever I've taught you, done. That is like more than enough. And then still I have showed you, I have in your hard book, hard copy, there is some pages are there which are already answers are written. So I just want you to just read those pages. That's all I want from you. Okay, there will be no further videos after this, and only hard copy has your cerebellum revision course booklet has continuation more pages also, which is again I have made it, and it's like again like a one liner. Just read them. That's it. and the videos will be till here only. Video segment will be till here only, because this is more than enough. So thank you so much, everyone. I hope you had a great time. I had a great time too. I can't remove my cap. Okay, so that's it. Life is beautiful. Believe you can, and you're halfway there. This much is more than enough. You can write a book after this. Directly, you can enter into PhD level. And life is beautiful. Please take care. So revise this much. Teach to your friends, and whatever extra pages are there, which I'm gonna there in the hard copy, read them. Just read them, because again, they're the same